Hi, everyone, and welcome to the program. My name is Dr. Vanessa Pomarico Denino, and I'm delighted to be here tonight with my colleague, Dr. Nicole Oliver. Nicole, why don't you say hello to everybody and introduce yourself?
Hi, everyone. I am Dr. Nicole Oliver. I am from Arkansas. If you can't tell from my accent that I don't feel like I have, but a lot of other people think that I do. So I am, of course, a nurse practitioner, and I'm triple board certified in family, adult gerontology, acute care, and emergency.
Wow, that's fantastic. So I'm a family nurse practitioner and I work for a large health system. I'm the lead clinician for diversity, equity, inclusion, and belonging. I also teach for Fitzgerald, different review courses and different webinars, as well as faculty for a number of schools here in Connecticut. So we're delighted that you're here tonight. We're going to be talking to you about salary negotiation masterclass. And any questions that you have, please make sure that you put them into the chat and we'll get to them at the end of the program. So Nicole and I have an awful lot that we want to share with you tonight. We're going to go through a lot of the different aspects about negotiation and that type of thing. We're going to talk about the different places, if you're inpatient versus outpatient, timing of things, and give you some strategies on how to be successful in terms of negotiating the best salary. So let's start out, with talking about preparation for negotiation. As we both know, as nurses, we never really had to negotiate our salaries, right? Everything was pretty much written. You walk in, you get a job as a nurse, and they say, here are the jobs that are available, and this is the salary range that you're going to get. And I know that in my program, nobody ever prepared me on what to do when I graduated, and I was really unprepared. It was actually my pediatric preceptor who gave me a copy of her contract and said, if you didn't learn this in school, we need to sit down and have a chat with you. And that's really what really made me want to get into this and empower other people to get the best salaries that they can get. So, Nicole, what do you think the most important factors nurse practitioners should consider in terms of researching before they negotiate a job offer?
So I think some of the most important things is that they need to know their worth. As a nurse, as you said, we just kind of go in and they tell us what we're going to make. There's no negotiation, there's no education, pay, or any extra things like that. And so I think the most important thing is to know your worth. And so some of the ways that people can do that, first of all, before you even enter into any kind of contract negotiation, you need to know what your scope of practice is in whatever state it is that you are going to be practicing in. Because some of us, I don't, Vanessa, do you know how many states have independent practice at this point? It was like 26, but
Yep, that's it. I believe that we're at 26 or 27.
yes. And so I live and work in Arkansas. I have licenses in several different states, as I'm sure that you do. And so people have different scopes of practice. And I'm just going to tell you from personal experience, when I graduated from nurse practitioner school, the first place that I worked was in the emergency department because that's where I worked as a nurse. And I remember distinctly, I went to the head doctor that was over the team, and what I did was I showed him my degree plan, and I was like, "Is this going to prepare me to work in the emergency department?" And he was like, "Girl, I don't know nothing about those. I don't know I know if you have a license, I'm going to hire you." And so I was like, I better learn my scope of practice because I'm not going to get in trouble with the Board of Nursing. And so if you don't know what your scope of practice is, like can you work and that's a whole nother conversation that can be a whole nother hour. But if you don't know if you can work in the emergency department in your state as a family nurse practitioner, that's one of the first things that you need to find out. You do need to, like I said, know your worth, know current salary for the job that you're applying. I look on salary.com and honestly, I just like chat GPT'd what does the average nurse practitioner in insert whatever primary care, acute care, whatever in Arkansas typically make salary range wise. And that's kind of a good jumping off point.
So I agree as well. Salary.com is a great place, and neither one of us have any financial affiliation with them.
No.
But one of the other things that I also suggest people do, in addition to salary.com, is to get a couple of other places and take the average of two or three different places. So you can actually go to the Department of Labor, and they will have actually online, you can get all of the typical salaries for different areas of the country. But also too, AAMP puts out a salary a survey every year, and I would really encourage all of you who are listening to participate in those salary discussions and those salary surveys, because it helps people like Nicole and I, when we're training other people, to really get a good idea of what's really happening out there. We know that a lot of times people can overinflate their salaries, which is why I usually tell people to go to more than one source, just to make sure that they're kind of getting a good average of what's really out there. But you brought up a really good point. You were talking about knowing your scope of practice. And I know that across the country, there's been a really big movement about, let's, for example, a family nurse practitioner. I have been educated as a primary care provider. Could I go to work at the bedside, inpatient? Sure. But in a court of law, is that going to hold up when they say, what in your primary care education prepared you to intubate a patient or to take care of a critically ill patient when your education was really in primary care? And for somebody like you, that you're quadruple boarded, I'm sure you saw a really big difference amongst the different types of education. So do you feel that that's an important thing to think about before they accept a job, whether or not it's a state, the state accepts that you can work? Do you feel like it's out of our scope of practice to work in a place like critical care?
I really think that, of course, like I said, each state is different, but I'm going to warn everybody right now that your credentialing department, wherever you're going to work, they do not know your scope of practice. And as I said with the ER guy, he was like, yeah, if you got a license, I'm going to hire you. And you need to advocate for yourself. And if you don't know if it's appropriate, like a family nurse practitioner obviously should not be intubating and doing things like that. But if you don't know, you need to call your board of nursing and you need to talk to whoever's over advanced practice and you need to ask them about that kind of stuff because they're going to be the ones that are going to be approving your licensure to begin with anyway. But like me, it's a little like sticky sometimes because I am triple board certified. And so it's like I can do a whole bunch of different things, but there for a while in my hospital, I worked as a hospitalist. It was like this hybrid ER hospitalist thing. It was actually pretty cool. But I got hired for that, and then some other people got hired for that. And two of the people I know were family nurse practitioners that probably shouldn't have been working either place, to be honest with you. And that's a whole debate, like I said, for a whole another day. But they were like working, rounding in the ICU and stuff. And I mean, I don't like to be a whistleblower or anything, but I'm like, this hospital is liable for the scope of practice of these nurse practitioners. And the big lesson here is to advocate for yourself. You need to know your own scope of practice because even if they don't teach you in school how to negotiate salaries and stuff like that, you need to know your own scope of practice so you don't get yourself in trouble. And another thing that Vanessa brought up that I kind of like triggered something in me is you can talk to other people. There was this big thing for a long time where you don't talk about your salary and you don't talk to other people about anything. And so that was just a big thing for a while. And I mean, to me, that's no longer the case because I can think of 20 people right now I could text and say, hey, how much do you make per patient? And that's another thing when doing it, and I think we're going to talk about this in a little bit, but are you getting paid per patient? Are you getting paid based off of RVUs? Are you getting paid hourly? Are you getting paid salary? And so, how many years of experience do you have? Are they counting your years as a nurse as experience for your NP salary? So those are all kinds of things that you need to think about too.
So those are such important pieces of conversation to have. So while we're talking about that, you were talking about advocating. How do you feel that nurse practitioners, especially new nurse practitioners, or perhaps somebody that's been out of the workforce for whatever reason and they're re-entering the workforce, how can nurse practitioners best articulate or advocate what they bring to the table in terms of their skills or their leadership experiences while they're negotiating. Because for so many years, we heard your nursing experience is not relevant. They're looking for nurse practitioner experience. But for people who have been nurses for 8, 10, 12, 20 years, they do bring an awful lot to the table. How do you think we can advise those who are here tonight, how they can articulate those skills and and their experience?
So, one of the biggest things that I always tell people, and it sounds very simple, but it really helps, is I said earlier to know your worth. You need to make sure that your CV is up to date and it has all of your nursing and leadership experience on there. And if you don't have that, you need to get one. And a long time ago, I Googled CV templates or something like that. And it took me forever to build my first one. And now it's funny because I actually have mine pulled up on my laptop right now because I updated it today in preparation for this. And it's really funny because I was sitting there and I usually update my CV like every month because I do a lot of stuff because I also teach review courses for the emergency and acute care for Fitzgerald and I do various other things. And we don't give ourselves enough credit for the things that we do. And so I was sitting there and out loud, my students already know that I talk to myself all the time. And so I was like, okay, I haven't updated this since June. What did I do in June? So I'm looking back through my Google Calendar and I was like, oh yeah, I spoke at that leadership thing. Oh yeah, I did this. Oh yeah, I did this. And so if you will look back through and build a good resume and then update it you don't have to do it every month like I do. Obviously, I haven't done mine since June, so I've been a little busy. But update it and it will tell your story for you. And so then you can advocate for yourself and you can try to get past that imposter syndrome, which could be a whole nother class altogether as well. And you can say, you know what, I did work on senior care. I was a clinical coordinator for senior care for a while, and that's a really good thing. I did get an MBA in leadership. I did do this stuff because we do so much stuff, and as nurses, we don't expect credit for it. And so therefore we don't think, oh, that's a really good thing that I did, or oh, that's going to help, bring my worth up. And so we need to make sure that we are keeping track of that stuff because it's so funny. I was like, why does this thing say Sheffield? I don't remember what I spoke on in Sheffield. And so then I'm looking back through my social media and I'm like, oh yeah, I spoke on that serial killer thing or whatever. And so it's just like I forget stuff because after I do stuff, I just forget about it because I don't expect credit for it. But you need to expect credit for it, especially when you're negotiating for a new role.
And it's so true. I do the same thing too, Nicole. After I do a presentation, I make sure that I update, and I have different versions of my CV.
Yes.
So because like you, I am very involved clinically, but I also do a lot of teaching. I've done a lot of publishing, and so depending on where I'm sending my CV for whatever event it is, I have a different version of it because you need to really speak to your strengths in your CV. Now, a resume is typically like 1 to 2 pages, and if they specifically ask for a resume, you need to keep it to 1 to 2 pages. But a CV is actually a curriculum vitae, actually is a Latin for course of life. So don't tie yourself in by just limiting it to 1 or 2 pages. You have to put everything down that you have done, like you said, to give yourself credit for what you've done. And that's what's going to bring value to the table. So, one of the examples I always think about are the clinical ladders in the hospital. I don't know if you happen to have them, but most of the larger hospitals have a clinical ladder. And I find that there's so many of my students that I'll say, well, do you have any special skills or certifications? Did you do the clinical ladder? And they thought, well, I didn't think that that had anything to do with it. You did clinical nurse 1, 2, 3, and 4. That meant you had to do different things. What did you do? Put that on your CV because you can bring something like that into a primary care office or a specialty office that's really going to make a difference. You had actually mentioned something about RVUs or being paid via patient volume. So we should probably touch on that a little bit for the people that are not familiar with the different pay structures. So, for instance, you might go into a position where they are going to pay you a straight salary and you're not going to get productivity pay. But let's say you're getting, they offer you a salary and then they say after a year, we will put you into the productivity because it takes you about a year to really build your practice, get a solid following. You want to talk a little bit about getting paid per patient versus RVUs versus not getting a salary and being paid on productivity, straight productivity.
Yes. So when you're negotiating, you do need to know how they pay you, and you can negotiate that kind of stuff. I personally would not recommend, especially when you first start out, getting paid per patient. Now there are some instances where that might be appropriate, and that would be like in a nursing home setting. A lot of times they will say you need to see 15 or whatever, and we're going to pay you per patient, and you got to at least see 15 or something like that. Because I was applying for a job at one point, and that was their pay structure. And from what I understand from talking to some other nurse practitioners, that's kind of the standard for nursing home if you're doing rounding at nursing homes. And I'll tell you about my first contract negotiation, which was an absolute nightmare. I'll just tell you like the short version of it so that you don't make the same mistakes that I did. But I did not have a class like this. I did not know that you could negotiate. I just thought it was just like nursing where you just took what they gave you. And so the first job that I had as a nurse practitioner, I worked in the ED for a little bit, and then I did that hybrid position. So what they did for me, and I'm sure I could take legal action, I'm not going to do it. It's just a hassle. But so what they did for me is they pretty much copied and pasted one of the physician hospitalist contracts, and they gave it to me. And so I didn't know any better. I was like, okay, well, I'm going to see, it says that I see no more than 15 patients in the hospital. And then in the ED, I see X amount of patients. And then I get a quarterly bonus. And that's something else that we can talk a little bit more about in a minute. And then, however many patients over that at 15 average per day, which you'll have to do a little bit of math, but over that 15 per day, then you get paid like $45 each additional patient, and then you get that every quarter or whatever. And so I didn't know you could negotiate any of that stuff. And so I just took what they gave me. And then whenever the first quarter rolled around, I didn't get a bonus. And I was like, what's going on with this? And I thought, okay, maybe it's like a rolling bonus where, it's off. Well, I made the mistake of not asking questions. And that's one of the big lessons here is you got to ask questions. You got to advocate for yourself. You got to speak up. And so anyway, 6 months rolls around. I'm like, okay, I didn't get a bonus. I'm going to ask about this. So I asked them, and they were like, oh my gosh, we gave you the wrong contract. They were like, this was not a nurse practitioner contract. This was a physician contract. And I'm like, okay, well, I signed it and you signed it too. So you owe me this much or whatever. And they were just pretty much like, no, we're not going to pay that. We're going to pay you like the nurse practitioners. And at that point, I'm a new nurse practitioner. I have, imposter syndrome just like anybody else. And I didn't know. I didn't know. And so this has been over like 10 years ago. I've been a nurse practitioner for about 11 years now. And so I didn't know that you could advocate for yourself like that. But that was a big mistake that I made. And then when I went into primary care, they pretty much what they tried to do, and I learned after that first contract, what they tried to do is just give me a contract that they said everybody else had, all the other nurse practitioners. And I was like, no, I'm not going to believe people this time. And so I started asking other nurse practitioners, and they were like, that is not true. This is what we make. This is what. And so you need to talk to other people and just make sure. Are you getting paid salary at the beginning of if you're working in outpatient especially, you need to be getting paid a salary. And so what they did with me is for the first actually 2 years, they gave me a salary no matter how many patients I saw. And then after, like they gave me a target number where I think I had to see 250 patients a quarter or something like that. It may have, no, it's 750. It was 250 per month. And so if I saw over that, then I got a quarterly bonus. And if I didn't, I just got paid my salary. And so that's an important thing for you to know if you're doing that. And like Vanessa said, you're trying to build your practice for the first couple years at least. And are you taking over for what I did in this primary care practice that I'm in now is I took over for a guy that retired. And so someone retired, And then another physician in that practice actually left and opened his own practice. So I pretty much absorbed two physician panels worth of patients that had both been working for a really long time. So, getting bonuses that first couple of years, I mean, that wasn't that difficult because I just had all of that, but you may not have that luxury. So for your first couple of years, I would try to get a guaranteed salary. Don't get paid per patient unless you're in one of the situations like a nursing home or something where they do that, and it's pretty easy to hit those targets. Quarterly bonuses is another thing. Typically, they pay you productivity bonuses and it's RVUs. And for the life of me, if you asked me 5 minutes ago what RVU stood for, it's something value units. I'm trying to remember.
Relative value unit.
There you go.
Yeah.
And Vanessa can probably give a better explanation of that. But anyway, they give quarterly bonuses based on that. And it's important to know how many patients am I supposed to see? Like what is my lowest number or whatever? When do I hit my bonus? That's going to be an important thing to know so that you can keep up with it because I'm not a very trusting person and I don't, and it's probably because I've been burned before, but you need to make sure that you're keeping up with that stuff so that you understand it and you know. And so every single day I look at we use Epic. I'm sure most other people do, but we use Epic and you can see your productivity in Epic, how many RVUs you have seen for the month and things like that. So I keep track of all of that stuff. And do you get bonuses at the end of the year? That's another thing to look at. One thing that I will caution you because one of my friends got burned this way, and this is how we learn everything is from mistakes of ourselves and others. But she went into an internal medicine practice, and they didn't. She thought she was going to have her own panel of patients. That's an important question to ask in your interview. Are you going to just take walk-ins, or you can have your own panel of patients, things like that. So she was told she was going to have her own panel of patients, and while she did have a few of her own patients, what they utilized her for mainly is Medicare wellness exams.
Mm.
And so they did not pay her a quarterly bonus, and she was seeing just a crap ton of Medicare wellnesses, and then she wasn't bonusing, and so that was just a big thing with her. So it's really important to figure out how they're going to utilize you because in my health system, the cardiology nurse practitioners specifically are pretty much used as scribes. And Vanessa can probably speak to this too because they'll go around and round on the patients, then they pre-write the note, and then the cardiologist goes behind them and they sign off on the note that the nurse practitioner wrote. So the nurse practitioner isn't really making any decisions as far as clinically, which I think is just an absolute misuse of education and training.
Oh, it sure is. And you bring up so many valid points. So let's go back to the RVUs. So RVUs are relative value units, and the American Medical Association, the docs own RVUs. They came up with the pay structure. And what it is every diagnosis has an RVU assigned to it. And it could be a little bit or it can be a lot. More procedure driven practices like orthopedics, dermatology, where you're doing, or even in your own primary care practice, if you're doing more INDs or suturing, the more procedures you do, the higher the RVU that's assigned to it. But I would caution all of you is not to try and cram all of these people onto your schedule just because you want to make more money. You have to remember that first year when you're a novice becoming an expert, you come in as an expert nurse, but you're still working as a novice nurse practitioner. You don't want the financial piece of it to be driving you to see more people because you want to make more money. You're setting yourself up for failure. But what you want to do is really take that first year or first 2 years to really just try to build your practice and then consider if they're going to offer a productivity structure. Now, there's so many different productivity bonus structures. I know some people that get 5%. I know other people that get 33%. So it all depends on the RVU productivity package that individual practice where you are interviewing what they're going to offer. Typically, most hospitals, so if you are working as a hospitalist, or if you're working in the outpatient clinics, a lot of the hospital systems don't offer productivity bonuses, but it is something that you can bring up. And it can add tens of thousands of dollars onto your base salary. So going into that, nurses need to really have a realistic expectation of what their salaries are going to be. And again, you need to do your homework on comparative salaries before you go to negotiate at the table. But what you really want to make sure is that you're not going in with an unrealistic expectation that, oh, I have 10 years of nursing under my belt. And the job is offering a range of, let's say, $110,000 to $150,000. You're going to ask for $150,000. I could tell you they'll say next and they'll go to the next person. So you need to be realistic about what your expectations are, what you are bringing to the table, and what's going to make you different that they should be paying you a higher salary. So those are definitely very important pieces that you have to consider as you're going through the negotiation process. So when many times, especially in the hospital setting, they'll say our salaries are set in this particular institution, and this is the range, and this is what we're going to start you out with. Nicole, how do you think people should respond if they say we don't negotiate? This is the salary. What if,
Well, if you're okay with that, then don't negotiate. You
right?
know, if you accept that, then that's fine. I worked in the emergency department for, gosh, it's 24 years now. I don't accept anything people tell me. And so typically I will say, well, according to, if you have data to back this up, then a lot of times they will listen to you and sometimes they won't. And if they won't and you don't want to accept what they have, then that's not the right place for you to work at. And so they kind of tried to do that with me in the primary care. Our salaries are set or whatever. And I'm like, well, according to salary.com in Arkansas, a nurse practitioner typically makes this to this in the outpatient setting. I've had this many years of experience already as a nurse practitioner. I'm triple board certified. And some other ways that you can get around like that very stringent is to look at the extras that they give you. Do they give you CME money? Do they give you CME days? How much vacation time do they give you? Do you have sick time? There's all these different little extras. Do they pay for your malpractice insurance? These are all things that you can negotiate that actually make your salary a bit higher. And they don't really see that because they're just benefits that are beside your salary. So I would negotiate for them to pay for your malpractice insurance. They need to give you CME days. In
Absolutely.
my personal opinion, I think 3 CME days is low, but 3 to 5, I think a week of CME pay and days and all of that, I think is completely reasonable. They need to give you vacation time. At my system, I've been there for 24 years now. And so they did different things. When I first started, they said, okay, as a provider, you get 4 weeks of vacation a year. And then they decided to lump the nurse practitioners in with the nurses when it came to PTO, which benefited me greatly, actually, because then I'm like, okay, now I'm on the top of the scale and I get like a day every 2 weeks or something like that. And that equals way more than 4 weeks. And so, and plus I get CME days and I get CME money every year. I get like $2,500 a year. So all of this stuff, I think I had something else and maybe like, do they have a retirement plan? Do they give you education time? Do they reimburse your education? Just a funny story. I mean, I guess it's kind of funny now, but I was like, I have every nursing degree. I have an associate's, bachelor's, master's, and I have a doctorate in nursing. And so I got a wild hair a couple of years ago, and I was like, you know what? I see that they reimburse for education, so I'm going to go back to school again. I'm going to get a master's in business, and I will be danged if they did not pay for every single bit of it. And so that's some extra like little benefits that you can get. And Vanessa, I'm sure you have some other things too. I'm in another master's program. I'll have 3 master's degrees next year. But anyway, I'm in a
That's
master's of public health because I'm like, oh, our very first nurse practitioner, Dr. Loretta Ford, had a master's in public health, and I'm going to do that too.
good for you. That's very ambitious. But it is true. So, when you are negotiating, you have to remember that employers are always going to look at the bottom line. So you're thinking about just your salary, but you need to think about what the benefit package is going to cost the employer. So you're thinking about how much money am I going to take home? But you're right, all of those things you can negotiate. So, some of the things that you can negotiate are if they only offer 3 CME days. Well, for a full-time employee, you should be getting 5 CME days. You should be getting $2,500 because let's face it, $2,500 of CME money doesn't go really far. You have to pay for your airfare and with the flights. I spoke at a conference. I live in Connecticut. There are no direct flights from Connecticut to California. And my flight was probably $800. And if, the people that I was speaking for, if they didn't pay for that, $800 out of my $2,500 plus another $500 or $600 for the conference itself. And then that might cover 1 or 2 nights of a hotel room, and then I'm out of money. So you really have to make sure that you're making sure that they know you're not going on vacation. You truly are going for the CMEs. And other things that you can negotiate are maybe more money into your 401k. Maybe you're not a morning person. Okay, and you might also be able to negotiate the fact that I'm not a morning person, but I'm good at night. So would you consider having me start later and I'll work later? Because how many of our patients don't want to take time off from work or they can't take time off from work? They would love to be able to come in. I have to tell you, my 2 evenings a week are usually filled all the time because people don't have to take time off from work. My 8 o'clock appointments are always filled because it's the first thing of the day. And then my later on appointments, especially for sick visits, if people don't really want to take that sick time. So don't be afraid to ask for all of those different things, covering your license every year. Now we
Yes.
have our RN and our APRN license. You should know,
And your
and your
certifications
certification. So if you're
and your
triple boarded,
DEA, my God, have them cover your DEA.
yes, that's $888 every 3 years. You really want to make sure it's a benefit to the company that you have your DEA, because if you don't have it and you need to write out a narcotic, unless that other provider in the office is seeing your patient and you're billing it out as an incident too, it becomes a liability for somebody else to write for any type of controlled substance. So getting your DEA, and again, these are things that should be automatic and not come out of your CME money. Your CME money should be for your continuing education,
Separate.
right? All right, so we can talk for an hour on all that, but there's a couple of other points that I'd like to get to. We had talked before we started today about credentialing, and that's something that a lot of people don't take into consideration. So you finish school, you graduate, you take your boards, you get your license, and now all of a sudden now you're applying for a position. Do you want to talk about the timeline for credentialing?
Oh, credentialing can take anywhere from 4 weeks, which that's if you're lucky, to 90 days or sometimes even longer. And so you have got to, I tell people to apply for jobs early, like a couple months, 2, 3 months before you graduate. Some places will not accept your application if you're not licensed yet, but some will. And so getting that stuff together, and then a couple of just like little life tips about that, just from personal mistakes that I've made, is you need paper copies of all the stuff. They're going to ask you, and I have this electronic as well. They're going to ask you probably for a picture of your diploma. They're going to ask you for a photo ID. They're going to ask you for any CPR, ACLS, PALS, anything like that that you have. I'm trying to think of what else they just, oh, a copy of your license, even though they can look it up themselves, copy of your certifications, all of this stuff I keep in a folder in my office, and your DEA certificate. And so anytime I get that stuff, I just put it in this folder, and then I have electronic copies of all of it too. And I just have a file on my flash drive that says credentialing. And so all of this stuff, if you get all of this stuff together, then it's going to make it a lot easier, especially when you re-credential, and it won't take as much time. But expect 4 weeks to 90 days or even longer for your credentialing whenever you are about to start. Now, another little tip that I have that you might could do whenever I started working as a hospitalist, I was like, well, I already quit my job in the ED. Well, like, what am I supposed to do? And so then somebody suggested to me, and I suggested it to the hospitalist group. I was like, hey, can I be a scribe, an RN scribe for you until my license comes through? And then I'll just start after credentialing goes through, then I'll just start as a nurse practitioner. And they were like, that sounds like a wonderful idea. And I pitched it to him because I was like, listen, I could do your notes and all of that, but then you can train me. You can give me a good orientation until credentialing gets through. And they were like, man, that's really good. And so I started doing that, but I made it very clear. I was like, I will not be a scribe after my APRN license comes through. I'm going to be a provider just like you guys, and I'm going to do all of the stuff that I can do because of my education and training. So those are some like tips that I have about that. I'm sure you have some too.
So, and the scribes, are fairly new, but you also, like you said, you don't want to get into a position where they fall back on that and say, well, our scribe called out sick, so we're going to have you substitute. You need to make it very clear. As nurses, we're so used to taking orders from, the residents and the attendings. But as the nurse practitioner, you are the one that's in charge. You are working to the highest level of your licensure. You are not anybody's handmaiden. And you need to make sure that you advocate for yourself and use the appropriate language in a nice way. You don't have to be rude about it, but exactly how you said it, Nicole. I'm happy to do this now while I'm waiting to get credentialed, but afterwards I'm not going to do it. It's a very gray area, though. If you're waiting for your credentialing to come through, a lot of institutions will not allow you to work until your credentialing comes through. And I'll tell you, the hardest time to find a job is usually in May and June, because
Yep.
everybody's graduating in May and June, but don't forget our new residents all start July 1st. So the hospital credentialing, even if you're working it as an outpatient, the hospitals are the ones that are doing the credentialing. And that they can get backlogged, at that time of year. Usually in December, if you're a December graduate, you have a little bit easier of a time, but it can get really bottlenecked in the summertime. So a lot of people don't they put their applications into a lot of different places. I know somebody that had to wait 9 months to get credentialed, and they were just about ready to walk away from the position because they said, I can't wait any longer and I'm going to move on to find something else. So there are times when you are able to get expedited credentialing. I actually was very lucky to do that. I had left my other practice to join the practice that I'm at now. And at the time, there was one nurse practitioner who worked 1 day a week, and there was a physician who worked 2.5 days a week. And it was a very busy internal medicine office. Two docs had retired. They were literally drowning. So the timing was great. I was leaving and starting in January. I had given notice in September at my other job, and the credentialing office said, "You probably are not going to start until February or March." And my boss got right on the phone and said, "You need to expedite this." So there are ways that they can get around it, especially for hardship cases. But again, don't be afraid to advocate. I always tell whenever I give a talk like this, I always say, we are our patients' best advocates, but we don't advocate for ourselves nearly as much. And you had mentioned that right at the beginning of the program. So you really have to make sure that you are using the same skills you would use on a patient, you would use for yourself. And just make sure that you can come across as confident without being aggressive or
Condescending.
assertive. You can come across as being confident, and that confidence is really what's going to impress those people who are, interviewing you. So we talked about the credentialing. How about, when you go in for the first interview, I always tell people, they spend 15 minutes with you and then suddenly they're offering you a position and you don't know anything about them. They don't know anything about you. So I always say that it's always a good time to maybe spend 4 hours or maybe a whole day kind of shadowing in the practice so that you could see the different prescribing habits. You can see how the flow of the office is. But at that point, when do you think you should bring up the compensation piece of it? Like if they offer you something right off the bat, what language would you use to kind of put that off, just to buy yourself some time?
So typically, from my experience, what they typically do is they'll give you, and it's every practice is different, but if it's a private practice, then it's a lot different than if it's a big hospital system like you and I work at. But when I first applied, they handed me this packet where, and it was basically the benefits package. It didn't have salary or anything, but it did have benefits package on there. And so I would just tell them, I appreciate your offer. I would like to do a little more research on this and appropriate compensation and things like that before I consider your offer. Or you can just, be like a lawyer and be like, is this your offer that you're giving me? Kind of like when people are like, am I under arrest or am I free to go? And so I would just ask them, so is this like a formal offer? And then just say, I need to do a little more research before I take this offer into consideration. And then I have some other points that I would like to look at as far as benefits. And if you want to discuss this at a later date, I'm happy to set up a meeting or whatever. Because that's one of the tactics that people use sometimes to try to get you like roped in and go ahead and sign your stuff. And I don't sign anything the first time I talk to anybody. And so I think that that's a pretty good rule of thumb. One thing I was going to mention, and I didn't think about it till just now about RVUs, is one way that I actually increased my own salary without them figuring out that that's what I was doing is one of the very tiny little negotiations that I did is they gave me a salary and then you got like a productivity bonus and I forget, it was like $28 per RVU, which is actually just way too low. And so I offered, like, I was like, okay, I'll take that salary, but I would like this much more per RVU or whatever. And they were like, oh, it's only $4 or $5 per RVU more. That's not a big deal. And then whenever I talked to other people, they were like, you get $35 per RVU. We only get $28 per RVU. And so it actually increased my salary quite a bit. So that was like a little thing I just now thought about.
So, and that's such a great concept to bring up because again, if you're not familiar with RVUs and they say, and it may sound really enticing to say, we're going to offer you $115,000 a year, plus we're going to give you whatever the bonus structure is, if they're going to, however, if they decide they're going to give you a percentage bonus or if they're going to pay you, a flat fee per RVU and that type of thing. And that's the other reason why you really want to talk to other people is to find out what other people are doing. Now, I will tell you that one time in one of my very first jobs, it was a part-time position, and the physician had offered me the same salary that I was making as a nurse at the hospital. Now, nurse's salary and nurse practitioner salaries are two entirely different things. You have to remember in outpatient, you're not working nights, holidays, and weekends generally. You
You're not
know,
taking call,
you're not, well, you might have to take call, but
maybe.
it may not be the same as if you were doing inpatient.
Find that out.
That's exactly. You have to find out how busy is the call and are you going to get compensated for it. But when you're negotiating all of this, one of the things you want to do is you want to find an attorney who is well versed in nurse practitioner language that is also well versed in contract language. It is an investment in your future. It may be, I know the attorneys in this particular area, they charge anywhere between $250 and $400 to review a nurse practitioner contract. And one of the attorneys that we tend to use in Connecticut, it's a smaller state, but he actually was the attorney that we used for our full practice authority language. So he's very well versed in nurse practitioner contracts. And it's a small sum to pay to make sure there's nothing hidden in those contracts. So I will tell you, in my contract, my very first contract, there was a morals clause in there. And I knew enough about contract negotiations. I knew enough, legal terms that I thought this is a little odd. And I remember asking the doc about it because they wanted me to sign right then and there, like you were saying, Nicole. And I said, I will get
Mhm.
back to you in 5 days. 5 days
Mhm.
is enough. It's a business week. And you're not asking permission. You're telling them, I'll get back to you on five. I'll get back to you whatever date it is. But you take that contract and have somebody look at it. And my morals clause basically said that, let's say I was at a party at your house, Nicole, and was drinking too much. I don't know, maybe I took some drugs and I'm dancing with a lampshade on my head on your table, and a patient happens to see it. then the patient goes back to my boss and says, your nurse practitioner was pretty wasted at a party. That morals clause would have gotten me fired. Not that I dance on tables and I don't do illicit drugs, but that's the point, is you need to know what the language is within the particular contract. So don't be afraid. You do not ask permission. You are in the driver's seat when you're doing this. So on that note, how often should nurse practitioners then reassess and renegotiate their contracts? Do you suggest that they do it every year, every 6 months? What are your suggestions?
So it really depends on what your contract is like. Because my first contract was a 3-year contract, and it was like this is what you get. You get what you get, and you don't throw a fit, like we say in the South. So this is kind of after you did all your initial negotiation, then it was a 3-year contract, and they would not hear negotiations in between them. So then when a different company took over, they have less of a contract and more of a one-page thing that you sign. And so every single year I renegotiate. And so what I did one year, and this actually got me a pretty decent size raise, but one year I applied at other jobs. And I wasn't looking for another job, but this is a tactic that I used. So I applied at some other jobs and they sent me offers. And so I took those offers and I took them up to administration and I was like, listen, this guy's offering me $135,000 or whatever and all of this stuff. So what would you like to do to keep me here? I'm one of the top earners of this organization. I had my CV out. I was like, I've won this award, this award, this award. I've been on the marketing page for all of this stuff. And I'm like, what are you going to do? Basically, I was probably nicer than that and a lot more professional, but that's pretty much the gist of it. And I got a raise out of that. And so every year I try to negotiate. And sometimes they're like, no, Nicole, we're not going to negotiate. And I'm like, cost of living. I know for a fact the nurses got a cost of living raise, and you've lumped me in with the nurses in for the vacation time, so I'm not a nurse when it comes to that kind of stuff. And so but I argue with people. I've been there for a long time, and I worked in the ED forever, like I said. So I mean, you can't just argue with people without having data to back it up, and I always have data to back it up.
And again, it's so important. You had mentioned about being able to monitor your RVUs on Epic, and I realize that not everybody has the ability to do that. So for those of you that are listening, and if you can't monitor your RVUs, ask for your numbers every month.
Hmm.
We are entitled to getting our numbers. I worked at a practice where the physicians did not want us to have the numbers because they didn't want us to know how much money we were bringing into the practice. And as soon as I heard that from our HR people, I thought, okay, well, I'm going to keep track myself. And so every day I'd keep a copy of my schedule. And at the end of the day, I would go back and I would put whether it was a 99214 or 99215, whatever it was. And I was able to then keep track of my own numbers. I learned, you learn by your mistakes. And now I make sure that I get my numbers. I'm able, like you, I'm on Epic as well. But I like to look at my numbers, and my boss gives them to me at the end of every quarter, just drops them on my desk. And he'll always say, are you happy? And I'll say, are you happy? And we go on. But for some people, we talked in the beginning about, maybe accepting a salary. Maybe some people don't want to negotiate. Maybe you're happy that they've offered you $120,000 and you're happy with that. But I just want to put a little bug in your ear. Most people, would you pay sticker price on a car? You're going to buy a car. Most people would not pay sticker price. They're going to haggle a little bit. When it comes to buying a house or a condo, most people don't pay the asking price. So I would just tell you, why would you accept the first offer without counter offering? And the vast majority of employers expect you to counter offer. And they know that they have a margin where they will allow for that counter offer and that counter negotiation, so that if they offer you $105,000 and you're not happy with that, the way that you can turn that around and say $105,000, would you consider $125,000? So you're shooting a little bit high, but you have to remember you're going to come back down and meet somewhere in the middle. And I always tell people, don't squabble for $5,000. Because if you're within $5,000 at the end of every week, you're talking about it's about $90 a week. Now, $90 a week for some people is the difference between paying the rent and putting food on the table. But at this level of professionalism as nurse practitioners. If you're within that $5,000 range and you really like everything about the job, you like the hours, you like the location, you like the type of practice it's going to be, the benefit packages are good, accept the position with a caveat and say, I'll accept this for now, but I would like a revisit in 6 months. And like you mentioned, Nicole, you have to come with your data. So in 6 months, you then go back and say, okay, well, in 6 months that I've been here, I've seen X number of brand new patients. I've done, I went on to get trained in Botox or whatever it is that you got specialized training in, and that you're increasing the number of procedure-driven types of RVUs that you're doing in the practice. You can't lie with data. That's how we got full practice authority in Connecticut. We got turned down the first time. We went back and we had data. You can't argue with the data. So make sure that you're keeping track of that, get your numbers, and don't be afraid to put that in your negotiation that you want to go back in 6 months to revisit it. And then put a reminder in your phone or on your calendar, because I can pretty much guarantee you the employer is not going to remember to revisit it in 6 months. All right. Anything you want to add to that before we start going into non-competes? I want to talk a little bit about some non-competes as well. So those are some of the hidden contract clauses that you need to think about. And like you said, Nicole, you were applying for other positions and you were getting these offers. Let's say you were getting ready to leave. You have to think about your non-compete clause, and they could be up to 90 days. And I will tell you that the vast
Or
majority
longer.
will hold you to that if you're going to leave. Some
Yeah.
other people you can give your notice and expect to work the 90 days, and they may escort you out of the building that day because they don't want you to take your patient panel with you. So there's a couple of different ways that you can get around that. Your non-competes generally are for about 2 years and a specific number of miles away. Now, in my teeny tiny little state of Connecticut, 2 years is long enough. But if they say you have a 60-mile non-compete, I would have to go work in New York, Rhode Island, or Massachusetts, one of the bordering states. I would not be able to work in Connecticut because our health system is pretty much all over Connecticut, and they count those 60 miles from the closest place to wherever it is you're going to work. So you
I made them take mine out. I just said, I'm not going to accept this if you don't take it out. And I gave that data just like you. Well, all of these, so and so facilities, I'd have to go to a different state, and I'm not doing that.
And that was just so you're reading my mind. That was the other thing that you can actually do is ask them to take the non-compete clause out. So case in point, I was working in a different town before this position, and I never had a non-compete. It was just kind of a gentleman's agreement with my the bosses the people that I worked with. And I said I really planned on retiring from that practice. Well, things happen. You just never know what's going to happen. And I realized that I was very unhappy. And what I started to do was get all of my patient information and started creating my own database because I was afraid that when I finally did find a job that they would have escorted me out of the building. But by that time, I probably had 75% of my patient data at home. So I was able to get that information. I had gotten the position where I'm at now. And when I came home after the doc had offered the second or third time that I had gone in and he had offered me the position, I went home and I said, I'm not sure. I have to go look at my contract. And he said, I'm not worried about it. Whatever it is, he says, we'll pay it off. I said, okay, that's great. I came home, I opened up my contract, and my boss at that time never signed the original copy. And I'm looking at it and I'm thinking, I don't have this kind of luck. So I said to my husband, could you just look at this and make sure that I'm not, crazy? And he goes, no, he didn't sign it. And so I called my attorney and I said, I've got this job offer. I have my original contract. He said, if you have the original contract and his signature is not on there, you have nothing to worry about. And I literally went 3 miles down the road and the doc could not do anything. So not everybody has that kind of luck, but you have to be really concerned about those non-compete clauses. Now, the other thing that I wanted to bring up is termination clauses. So let's say you're really, you're doing your job. Maybe you're not terribly happy, but you're kind of going through everything. And they then come to you and say, you're not making enough money, you're not meeting your metrics, we can't afford to keep you here, so or whatever their particular reasons are, and then they say, tomorrow will be your last day. You have to think about those termination clauses because it works both ways. So if you have to give 90 days notice, then it should be the same with them as well. Remember that you have to remember that every state in the country except Missouri are an at-will state. So that means that they can have these termination clauses because everybody is at will at that point. Do you have any experience with that, Nicole, that you want to add into that?
Um, I completely agree with everything that you've said. You've got to read that, and that's why I highly recommend getting an attorney as well, because little things like that can make or break you as far as getting your next job or whatever. And the institution you work for may have to pay out that 90-day notice that they were supposed to give you or pay it out. So you need to make sure that you know that, because some places, like she was talking about the termination clause, if you leave before your contract is up, then you have to pay back like your sign-on bonus or something like that. And so, yes, you need to make sure that that you know that stuff backward and forward. I see a couple of questions in the Q&A. One of them, I think, someone says, Lindsay, what about if you flip between outpatient and inpatient? That's a really good question because I did that too, and so that is a thing that you need to look at as far as salary ranges if you flip between those two. So I would look at inpatient salary ranges for nurse practitioners in your state as well as outpatient, and then somewhere in between there is probably closer to the inpatient because you get paid more inpatient. But I would look at that kind of stuff and kind of do a mesh between those two if you're going to flip between inpatient and outpatient. I did talk about what if your institution gives out yearly raises similar as nurses? Do we attempt to negotiate then? Absolutely. I definitely would.
The thing is, if you don't negotiate, then it's almost like you're
The
kind of
answer is always
setting.
no if you don't
And,
negotiate.
and, and if they say no, what's the worst thing that can happen? You go, then you have to decide, am I going to take the job or is it time for me to walk away? And it's okay to walk away from a position. You'll
Mhm.
find something else. I always say your first job is not necessarily your last. And like you, Nicole, it took us a couple of jobs to get that experience to feel comfortable. Our whole point in doing this tonight is to really empower you with some of the key aspects so that you feel comfortable going in and making these negotiations so that you can get the best contract that you can. Now, did I fell flat on my face the first time I negotiated a contract because nobody taught me how to do it.
Me
It was
too.
only through learning, like you, learning through the different aspects of it, that I was able to then get the experience and get the confidence that I needed. But also, too, you just have to remember that not now doesn't mean no. You can always ask for a revisit in 6 months. And even if you don't do something for the first year, you have the experience and the data to then increase it for the following year.
One thing that happened to me is whenever I was applying for some other jobs, just to renegotiate my salary or whatever, I took the offers and I took them to administration and all of that. Well, then I declined both of those offers because I was honestly using that for experience to look at contracts for one thing, and also to see if maybe something else was more appealing. And at that time, it just wasn't for me. But one of those recruiters from one of those places, after I declined the job, like a year later, she got a job at a different health system. And she was like, I remember you from whenever she pretty much poached my name, I guess, kind of from her previous like applicants. But she offered me a job like a year later because she went to work for a different place. And she was like, I remember your leadership experience and all of this stuff. And so, anyway, she was trying to offer me a job from a completely different place. So you can stand out when it comes to stuff like that. And then, I mean, you just never know because I was very surprised to get that call. She emailed me first and then, or she called me first and I didn't answer because I didn't know the number. And then she emailed me and I was like, oh my goodness.
So just remember, as a nurse, especially now, there's a lot more bonuses and you get shift differentials and that kind of thing. So I hear this all the time. I moderate a number of different Facebook pages, and the biggest thing comes up, well, I make more money as a nurse. You have to then ask yourself, why did you become a nurse practitioner? And the salary is going to be very different between being a nurse and being a nurse practitioner. But after that first year, you really can make more money again, what we talked about, the RVUs or the productivity bonuses and that kind of thing. Don't be afraid to take the leap. Don't paralyze yourself and stay in a nursing job just because of the money. Ask yourself, why did you become a nurse practitioner? And then move along with it. You won't be sorry. I know that people, it's a very hard economy to be living in. I recognize that. But again, remind yourself why you became a nurse practitioner, and then you will negotiate your salary. And the more experience you have and the more you have proven data, they can't argue with it. And if it comes down to the point where they don't want to give you a raise in a year or 2 years, then you, again, update that CV and don't wait until you're looking for a job because all those details are going to be lost. Keep it updated regularly and then start your search somewhere else. And, eventually you will get the job of your dreams. I can promise you that. So, Nicole, this has been absolutely wonderful. I hope everybody who joined us tonight has gotten some benefit out of it. We are out of time. So, if you do have any other questions, please make sure that you put them in. Otherwise, we hope that you enjoyed the session and we'll say goodbye until next time. Thank you, everyone.
Thank you.